Hello and welcome to ETX Covered. I'm David Littman. The Delta variant of coronavirus is changing the arc of the pandemic, so the CDC says we need to change how we behave. It tightened up its mask guidance for people who are fully vaccinated. Now, it believes they should go back to wearing a mask when they're indoors in counties with high or substantial community spread, which includes all of East Texas. It also wants everyone, vaccinated or not, to wear masks when they go back to school. The VA has gone even further, requiring all its healthcare workers nationwide to be vaccinated. The state of California and state and city of New York are making all their employees either get vaccinated or take weekly tests. And more than 50 health organizations, including the American Medical Association and the American Academy of Pediatrics, called for all healthcare workers to be required to get vaccinated. The number of new infections per day has nearly doubled in the last week in Texas. Hospitalizations have tripled in just 3 weeks, and the number of people dying per day is on the rise too. So state leaders say there's more urgency to get people vaccinated. To help us understand what's happening, let's talk to Dr. Jennifer Shuford, who's the Chief State Epidemiologist. Dr. Shuford, thanks for being here.
Yeah, thanks for having me.
As you look at the numbers and see this latest surge in COVID-19 in Texas, what do you see?
I can tell you that this latest surge has us really concerned. We are seeing really steep increases in number of confirmed cases and in number of hospitalizations, and we're starting to see increases in fatalities following those things. And so those are big concerns of ours for sure.
Are the basic conditions similar to the spikes that we saw last summer and last fall, or does this feel like a different kind of surge?
It's an excellent question. I think it's the same and different. And so the symptoms that people are seeing with this most recent surge are the same. You know, we're still dealing with COVID-19, but we are seeing slightly different patterns now. We're just at a different point in the pandemic, right? So we've got lots of people who have been vaccinated, but none of those really young kids have been vaccinated yet, and fewer of the young adults. And so we're seeing different patterns where a lot of the younger people are getting infected, and we're seeing increased hospitalizations, even in those under 18-year-old, the kids and adolescents, as well as young adults, like in that 18 to 39-year-old age range. And so it's worrying us in that some of those populations that felt really confident before that they weren't going to be severely impacted are starting to become impacted, making kind of this prevention message of vaccinations and other interventions, prevention steps like wearing masks and distancing even more important right now.
You talked about the younger people being more impacted and more likely to end up in the hospital. What makes this different than before?
So what we are seeing right now with this steep increase in cases is we are seeing the impact of Delta variant. You know, they've already seen this in other parts of the world where this Delta variant is so much more transmissible, meaning it just spreads so much easier that it can just rapidly work its way through a population. And so we're seeing that happen here in the United States and specifically here in Texas, where just over a matter of months, Delta, which we only even identified in Texas at the end of March, now probably makes up more than 75% of our cases. And so this Delta variant is spreading like wildfire and particularly impacting just those people who don't have that protection that the vaccine provides. We know that there are some breakthrough cases of infections amongst people who are vaccinated, but it's especially spreading and impacting those populations that haven't been vaccinated yet. And that's where those younger populations come in, because they just don't have the same vaccine coverage that we have in older populations.
So do you feel like this surge could have been prevented with higher vaccination rates?
I think this surge prevented, I think we're still going to see some circulation of viruses, and Delta is perfectly positioned because it's so transmissible to be the strain that's circulating. But every bit of vaccination in our population helps. We know that the vaccines that we've got are effective against COVID-19, including that caused by Delta variant. And so vaccination is the number 1, 2, and 3 thing that you can do to protect yourself and people around you. Because vaccination can prevent infection and therefore prevent spread of the infection, then that's going to be the number 1 thing that we can do for, like I said, ourselves and our families and our communities, is to get vaccinated and to get fully vaccinated. For the Delta variant, we know that getting that full vaccine series is really important, maybe more important than it even was before. That second dose of a Pfizer or Moderna vaccine is what really provides that full protection. And so vaccination really is where it's at. Now, there's going to be some people who can't get vaccinated, like kids who are 11 years of age and under. They aren't even eligible yet. And so for those people who can't get vaccinated or haven't been able to yet, it will be important for them to protect themselves and others using masks, masks and physical distancing. We did it for a year and a half. Nobody liked it, but it's effective. And not only was it effective against COVID-19, it was totally effective against influenza too. We had next to no flu season last year. And so we know those things work, and they'll continue to work for all those people that can't get vaccinated. But for those that can, vaccine is the best protection that we can offer to ourselves or our communities.
More with Dr. Shuford coming up. I'll ask her how many Texans might be protected against the Delta variant and if we know how bad this surge might get. So stay with us.